Morning, everyone. Thank you for being here. For the attendees, we are particularly grateful for you and your interest in finding out what resources are available to you for support for the food, beverage, hospitality industry. I'll be keeping an eye on the chat. So as folks are sharing and doing a 5-minute introduction to showcase the resources available through their organization, please feel free to input any kind of questions, any follow-up information you would like in the chat. And as soon as everyone is done sharing, I'll be sure to ask those questions for you and make sure that we offer additional information. And we can go ahead and get started. And I will pass to Erin with CHOW.
Thank you, Jasmine. I'm going to try to share my screen. So yeah, I am Erin Boyle. I'm the CEO of CHOW, Culinary Hospitality Outreach and Wellness. We are a nonprofit that supports wellness within hospitality through shared stories, skills, and resources. We do that by offering group discussion meetings. We have 6 meetings a week. They are all facilitated by someone that we call an expose, a person who has lived experience with mental health and or substance use disorder, and they've been in the hospitality industry for at least a year. Our meetings are currently in Spanish. We have one in Spanish. We have one for men and one for women. The rest are open to everyone, and all are available on Zoom. So you just need a telephone to log into any meeting. You can show up any way you want. If you want to have your camera off, if you want to put in a fake name, we respect that some folks aren't ready to out themselves as a person with mental health or substance use questions. So you are welcome to show up however it feels comfortable to you. We do these meetings because they have been scientifically proven to help prevent disease, manage chronic disease, and help people with challenges. They are open to everyone in the industry. So we have a short list down here: chefs, servers, bussers, bartenders, owners, suppliers, dishwashers, and industry veterans, students. However you identify as a food, beverage, and hospitality person, you are welcome. Even if you haven't been in the industry for a few years, you still have the emotional scars of being in the industry. You're one of us. Additionally, we have education. We offer what we call our mental health and muse course. It's a 4-hour training that gives people just a bite into the world of mental health and substance use, and then how to help themselves or someone else that is working with them. We also do some education around conflict resolution and active listening. Additionally, we have a workbook for wellness. So folks that want to work on their own time, these have vocationally specific resources and can help you kind of figure out how you're doing in all of the areas of health. We've got a workplace wellness toolkit. This was created based on what's working at organizations, and it's an active living document that we keep adding to as we hear good things so that you don't have to recreate the wheel. We have all sorts of downloadable or printed resource materials. We are working on scripts for hard conversations. So since most of us don't have a human resources department, we've created scripts so that you have a place to start with these challenging conversations. We're also working on a text service that's going to give you bite-sized, digestible content about mental health and substance use disorder. We also use an employee assistance program within our team and our volunteers, and I'm happy to talk to anyone anytime about how those work and the advantages and disadvantages and other opportunities for clinical services. And lastly, we're a resource broker. So we've partnered with a ton of organizations, including the folks that you're seeing on screen now. So we might not be able to help you, but we know who can. So for example, we work with a group called Kesed Wellness that offers pro bono individual clinical therapy to folks in the hospitality industry. And we've got resources to help you get health insurance, and even if you just need a good yoga studio or you want to network, we might be able to help you with all that. So that's who we are. I also just want to walk you through how to use us. So you'll go to our website, chowco.org. You can scroll down and see today's meeting, just right here. You can also go to the meeting site and check out the calendar. So you can figure out if you want to go to the men's meeting, you can find the men's meeting on our calendar. You can also look for our mental health and muse course on the Get Involved page. And that'll help you sign up for the education. We also have a resource page that's available with a robust list of opportunities to get help. If you're not sure what you need, but you need something, please go to our Contact Us page, and that's under Get Involved, and that'll connect you with Jasmine, who gave us our intro. And with that, I will pass it on to the next person.
Hi, everyone. I am Kat Bill. I'm the Chief Mission Officer at Southern Smoke Foundation. Our mission is to provide emergency relief funding and mental health services to anyone in the food and beverage industry. So we are located in Houston, but again, we do serve nationwide. So really everything that we do surrounds crisis. So if you're experiencing some kind of financial crisis that has caused you to miss work, or if there's a natural disaster, then we understand that missing one shift can absolutely become a crisis. So that is what we're here for. The way that we work is we encourage everyone to apply through our website for help. And we have a very easy set of guidelines in order to qualify for financial assistance. That is, one, you have to work 30 plus hours a week in the industry. That can be 2 jobs, 3 jobs, as many as it takes, as long as you meet that 30-hour requirement. And you need to have a 6-month work history. So as long as you're working in the industry for that 6 months, then we can go ahead and qualify you and open up a case and provide you with a case manager to help you get that emergency relief grant. If your crisis took place within that 6 months, and that is what is hindering you from being able to work, then of course we'll take that into consideration. So we're very case by case here. And as is everyone on this call, we all work together to make sure we're serving you. And a lot of times we kind of cross-reference as well so that we can get you all as much help as possible. So that's a little bit about the Emergency Relief Fund. Again, everything goes directly through our website, and you can find all of the information there. It's pretty easy to just kind of navigate. And once you apply online, then again, we'll get back in touch with you and take it from there. One thing we're always going to ask for is copies of your pay stubs. So the best way to be prepared to apply to Southern Smoke is to have copies of your pay stubs so that we can go ahead and move as quickly as possible. The second step is to have supporting documentation for that crisis so that we can have the materials we need to move you forward. For instance, if it is a medical crisis, then we're going to want to see a diagnosis, a hospital bill, so that we can go ahead and then apply that to the need and determine what it is that we can help you with. If that's living expenses, medical bills, all of the above. So that is our emergency relief fund. I'm going to pause really quickly. Does anyone have any questions? I'm going to look at the chat. I don't see much coming through. Okay, great. I'm going to move into our mental health program. Our mental health program, called Behind You, is an effort that started in Texas and is growing throughout the United States. We're in 5 states right now. And the way that the program works is we provide no-cost mental health counseling to anyone in the industry within the states where we're located. Those states are Louisiana, California, Illinois, New York, and Texas, with quite a few states coming in the next year. So stay tuned. If you would like to apply for that and receive a referral for no-cost counseling, you can also do that through our website, and the guidelines are the same. So 30 plus hours a week in the industry with a 6-month work history. Again, with the mental health program, the states that we're in, you will be connected with a local university partner. So the way that we provide the counseling is we act as a conduit. We partner with universities that have training clinics. So you will be assigned with a student who has a supervisor and a whole team behind them who can help you get an assessment and then receive 20 sessions or 6 months of counseling at no cost, whichever you hit first. Let's see. I think I see a question coming in. Yes, we actually are actively working with Virginia to bring it's a very, very state of demand. We have a lot of people who are trying to support us there. So I'm going to make sure to include my information at the end of this call. And if you'd like to help get involved with bringing this program to anyone to your state, please reach out to me and let me know. I can let you know what the efforts are going on there and how you can get involved. Does anyone have questions about how the service works? One thing that we really like about this program and that is unique is that we provide telehealth and also services on Mondays. The way that we develop the program, just like everyone else on this call, we're very focused on breaking down barriers. So we want to make it as accessible and affordable as possible. So we try to make sure that we can meet the unique needs of our industry. So that's the Behind You program.
Kat, I'm really sorry. Time is up. I will move on to the next speaker.
Sure.
And speakers, if you want to just, I will keep an eye on the chat for you and make sure that you have the appropriate questions fielded to you at the Q&A at the end. And we will move on to Alex Jump with Focus on Health, please.
Hi, everyone. Good morning. Thank you for coming to hang out with us today. My name is Alex Jump. I'm the Director of Operations and co-founder at Focus on Health. We are a for-profit company based in the United States. My partner is in Washington, D.C., and I'm in Denver. So we don't necessarily say that we are located in a specific city because we do events kind of nationwide. And our company mission is to provide people who work in the hospitality industry with the tools, resources, and education that they need to live healthy, holistic lives. We do that through the 5 pillars of wellness. So those pillars for us are financial, social, environmental, mental, and physical health. And our company really came about because of my and my partner LP's lived experiences working in the hospitality industry and struggling to take care of our own well-being and seeing our colleagues, mentors, and friends struggling with that as well. So the programming that we currently offer is in kind of like 3 different buckets. So we have programming that is along the lines of trade education and advocacy, and that programming is a no and low pop-up that we have done throughout the course of 2023. And we've done that in 6 cities across the US, from Seattle to Washington, D.C. And D.C. actually will be our last event. Hopefully this coming December 5th, which is actually Repeal Day. So if you happen to live near the DC metro area, stay tuned and I'll get an invite sent out. We'd love to see you there. That event is both trade education and a pop-up. And the goal of that event is to inspire inclusive environments where all people of both our industry and our guests and consumers are made to feel like they are welcome and a part of the party. And it also functions as education to better inform our industry of how non-alcoholic products are made, the importance of utilizing them on your menu, and everything kind of around that area. So that's the first bucket that we work in. The other buckets that we work in, we do some mentorship programs. So this year we started 2 different scholarship programs for trade that are trying to help bring marginalized people from perhaps less populous areas of the United States and give them access to the same professional development resources that other people in our industry have easier access to. So we took 12 bartenders to Tales of the Cocktail this summer from basically tertiary markets across the US, and ensured that they had as few expenses as possible to attend that program. And then this fall, we took 9 bartenders to Portland Cocktail Week for the same experience. So we'll be continuing that next year as well. And then the third bucket that our work lives in is something that we're starting to move towards. We're hoping to collaborate with CHOW here in Denver this coming year on some more wellness education in the world of harm reduction, overdose prevention, substance use and misuse, suicide prevention, and things of that nature. We do a lot of consulting work with brands, bars, and restaurants as well, whether that's in the space of helping them develop no and low drinks and programs, or talking to brands and bars about our lived experience with health and well-being in the industry. We're not mental health professionals or subject matter experts. We just have our own experience. So we also do a lot of collaborative work with people who are on this call and also not on this call, so that we are always making sure we're speaking from the safest, most well-educated standpoint, while also speaking from our lived experience. That's it.
Great timing. And we will pass to Caitlin with Giving Kitchen, please.
Hi, everybody. Thanks so much for being here today. You guys are amazing for showing up and taking care of yourself and learning about opportunities that are available for you in a time of need. Everyone on this call is fantastic. We all work together very often. So a little bit about Giving Kitchen. We're a nonprofit organization that assists food service workers in crisis with compassion and care. And we define a food service worker to be anyone that's employed in a restaurant, catering, concessions, cafeterias, food trucks, or bars and tap rooms. And we serve across the United States and in U.S. territories. Our programming is kind of in two big buckets, or two major pillars. Our first bucket that I'm going to talk about is our Stability Network program. And essentially, to qualify for Stability Network, someone would just have to have worked in food service in the last 30 days. And Stability Network is a lot like what Aaron so eloquently labeled as a resource broker. That phrase is fantastic. We essentially work with clients across the United States to connect them to low, no cost, or incredibly affordable resources around three kind of major categories of care. We focus predominantly on access to physical and mental health, substance misuse, and then also looking at housing and utility opportunities. And so if you reach out and have needs that are related to those things, we have partners across the U.S. that are either nationwide, local, or statewide that would be able to address that need for you. Or we would do our best to try to find one for you. So that's our Stability Network program. Again, you only have to have worked in food service in the last 30 days to qualify, to be able to access those resources. Additionally, you can access a very large portion of them on our website, on our Stability Network library. Right now, we have over 780 resources listed for the public, and you can self-navigate that at any time. Additionally, we have our financial assistance program. Our financial assistance program was kind of the foundation of Giving Kitchen. And essentially, we work to assist any food service worker that's experienced an illness, an injury, the death of an immediate family member, which we would define as typically being a child, a sibling, a spouse, a parent, or a grandparent. Or if you experience a natural disaster like a flood, fire, or some other natural disaster that compromised your ability to stay in your home in the last 6 months, you could potentially be eligible for living expense assistance through Giving Kitchen. So our parameters kind of request that the crisis happened in the last 6 months. We do operate on a 6-month timeline. And so if you are employed in food service, when that happens in the most recent 6 months, we would be able to potentially assist you with financial assistance. If you reach out and you have experienced those things, those are absolutely a crisis, along with everything else that kind of throws you for a loop, right? We understand that those 4 qualifying crises don't make or break what you are experiencing in your personal life. And we identify that there are a lot of crises that fall outside those parameters. And that's what our Stability Network was literally built from, having people reach out to us in really dire straits and really tough situations that didn't qualify for financial assistance as we've outlined it. So we have both those programs for full support. Additionally, we also offer pop-up docs, which are free days of healthcare for food service workers, predominantly right now in the Southeast region. We work with local sliding scale clinics and charitable clinics to offer free healthcare, and the clinics themselves kind of determine what services those offer. So we've had basic physicals, check-ins, labs that have been run, but some do, women's health, OBGYN services, podiatry services. It just kind of depends on the clinic. So if you're interested in whether or not you're going to have one of those close to you, I'm happy to share my information and can let you know when those are coming. And then lastly, we also focus on a couple of mental health related programs. We have our QPR suicide prevention program, which essentially we extend to any food service worker. You can go online to givingkitchen.org/QPR, learn about how to take a 45-minute training and be a real spokesperson and thought leader in your own space on how to identify when someone might be approaching a mental health crisis and what to do in those scenarios. And then additionally, we also have a substance abuse recovery initiative program. Our goal is to acknowledge that substance misuse is a mental illness, and we clarify and classify it as that. So we work to help get folks connected to affordable resources, and then also, potentially help them with financial assistance if they have the right documentation to complete a certain amount of training, or not training, but actual services. Qualifications all online. You can visit us, givingkitchen.org/help for all the additional information.
Thank you. And we'll pass to Mickey with Ben's Friends, please.
First of all, hello, Erin. Thank you for inviting me to this. And honestly, I'm honored to be here with each of you. Amazing work you all do. My name is Mickey Baxton, Charleston, South Carolina. I am the co-founder of Ben's Friends. Ben's Friends is a national organization with one and only one goal: helping anybody in the food and beverage industry struggling with addiction. We primarily focus on alcohol, but the reality is we are seeing people from every addiction walking in. Drug and alcohol has become really our primary mission. We do it through community. We do it with live meetings in 23 cities, national meetings every single day on Zoom. People from all over, line cooks, chefs, bartenders, waitresses, waiters, come to Ben's Friends to find a community of people who are like themselves and who have found a path to sobriety. And that's all we focus on. We do it by connecting people with each other. A great example, yesterday, a 40-year-old female chef from Portland reached out, came to the first meeting, and by last night she had talked to 5 other chefs in the Ben's Friends network around the country who are now working with her to help her stay sober. We are not like AA, even though our meetings are very similar to AA. We do not have a God concept component. We do not have a step component. What we have is familiarity. We understand the lifestyle that each of the restaurant employees have. We have lived it. We have lived it both drunk or high and now sober, and we share our experiences with each other. We are willing to help anybody who comes to us. We charge nothing to anyone. We work with a lot of restaurant groups around the country. They are not charged. The person coming for assistance is not charged. All I care about is, I'm 40 years sober, and I've spent 40 years in the restaurant industry watching people die, watching people destroy their careers. And for me personally and my co-founder, Steve Palmer, all we want to do is help anybody who is struggling find a path to sobriety. We don't care what path they find. We don't tell them they must do this. We just help them on the journey to find the path that works for them. That's Ben's Friends. You can find us at Ben's Friends Hope. I am willing to give my next 2 minutes to the next speaker. So thanks for having me here.
Thank you, Mickey. We'll pass to Tom Brennan with Big Table.
Well,
Hi,
Mickey,
Tom.
Mickey, God bless you and everybody else. Can you hear me okay? Yes?
Yes.
Great, thank you. Let me just share a couple of quick slides. So I'm Tom Brennan. I'm the city director, brand new here since March in Colorado Springs. Big Table's a nonprofit. And I'll tell you a bit about why we're in business here. So most of you probably realize, let's see, how do I get rid of that so I can read? That if you were to take the restaurant and hospitality industry and combine them, it makes up the largest industry in the nation. And this combined industry has some of the lowest paying jobs in the country. And 1 in 6, we estimate, of those working in the restaurants are below the official poverty line. And many of these folks live paycheck to paycheck. So the highest concentration of need from our point of view is hidden behind the smiles that are those that are working in that combined industry. So Big Table exists to support the people in this industry, and we do 4 critical things. We empower people that work in that industry to care for each other. We enter their lives gently. We eliminate barriers in the midst of a crisis that they happen to be having, and we invite them into ongoing community. And it all starts with a referral from someone that cares, that's working with them or knows them, and they know that they're in trouble. Our unique referral model gets us to those people that are in most need fast. We provide timely intervention for people that are in crisis, but we don't stop there. And that's what's unique about Big Table, is that we come alongside the human being, not only with a timely intervention for a moment of crisis, but if we don't have the capability to help them in that moment of crisis, we connect often with many of you. There's an amazing network of community of care here in Colorado Springs and elsewhere. So we've worked with a number of you people, your organizations already, to help those folks. So not only timely interventions, but we come alongside them with ongoing relationship. And so what we try to do is to help catch people before they fall with timely intervention, intentional relationship, and transformational care. So a big supporter of ours, for example, here in Colorado Springs is the Springs Rescue Mission. They love what we do because Jack Briggs, who runs the mission, says, look, we love what you guys do, because if you can catch people before they fall, that's great, because otherwise they come to the mission. In terms of the broad numbers, I think the big takeaway here, we could share another time. We deal with a lot of the spectrum of issues that come across that all of you deal with. We deal with all of them as well. And that's why the connection with all of you is so critically important, because the more we're aware, the more we can come alongside the human being and really help them with the trajectory of their life, with intentional relationship. And many of you will be part of engaging with us to help these people. But you can see the breakdown of what we run into mostly is housing stability, utilities, medical and dental care, mental and emotional health, job readiness, transportation issues, addiction recovery. So we come across folks with everything. And we're not, like many of you, we're not mental health experts or so on. We have our own experience, like you said, Mickey, but we provide life coaching, and we engage with the care community to help the individual. We are based in Spokane, Washington, San Diego, Nashville, and now the newest city is Colorado Springs. And of course, you guys can appreciate that the demand across the U.S. is huge in this combined industry. So we're being drawn into many, many other cities around the country right now. And we do everything we can to be operationally efficient. We about 83% of the donations that we get go to direct care. So we try to be extremely low overhead and operationally effective, and put most of our money to direct care with the people, which I think is really critical. And there really is an actual big table. The big table is actually 45 feet long, comes in sections, seats 48 people, and it's just we do 3 of these a year in each of our cities, and it's an actual celebration of people that serve us. We actually get sponsors and people to volunteer. We get volunteer chefs, we get volunteer servers, and they actually serve people at the table. And if you've ever experienced one of these things, there's just an incredible buzz in the room, and the joy that comes out of these industry dinners is just wonderful. Really, really cool. So that's just a brief intro. That's how you can reach us, tom@bigtable.com, and would love to share more with you as we go through time. Thank you for allowing me to be here today.
Thank you, Tom. And we will pass to Zia with Restaurant After Hours, please.
Good afternoon, everybody, or morning to some of you, actually. My name is Zia Sheikh. I'm the founder of Restaurant After Hours. We're an organization founded in December of 2018 in Brooklyn, New York, providing mental health advocacy, education, resources, and support for the hospitality industry. Before I start talking about the organization, I also just want to say thank you to everybody that is here on this call, just because as somebody in recovery, I've also used a lot of your services, so I can attest to just like how much all of you care about people that are in our industry, as well as like, you know, the support that you give everybody. So I just want to say that it is an honor to be on this call with all of you, and thank you so much for inviting me and letting me share here. I've worked as a chef in this industry for 20 years, and in 2018, I found myself in a position where I had no job, no insurance, and an alcohol dependency. I ended up taking 6 months off from the industry to work on my mental health. However, I really didn't know where to start. And I started pulling together all these different resources that were accessible, that were low cost for people in my position. And it was through that research that Restaurant After Hours was born here in New York. In the last 5 years, we've grown the organization now to have 9 team members, including 4 therapists. Our services are completely free to use, and we offer these services in 3 distinct areas. For individuals, we have over 200 resources listed on our website that provide everything from crisis numbers to educational resources to finding a therapist. We also offer education support on how to use these resources, and we are available at any time for any questions. We want to support everyone on their mental health journeys as much as possible, and we do this on a case-by-case basis. For workplaces, we work with hospitality teams to provide mental health first aid training to salaried managers and hourly workers, help with HR documents to aid with onboarding, mental health posters to hang in workplaces, and most importantly, help start a much needed conversation that is lacking in most hospitality workplaces. If you are a manager and do not know how to approach somebody undergoing a mental health issue, we will show you how. Along with this, we also provide resources for you to have on hand to refer individuals to what they may need. On a community level, all of us advocate for a healthier industry. As hospitality workers, we bend over backwards to take care of our guests, but very seldom are we ever included in that conversation to take care of ourselves and one another. We have these important conversations to reduce the stigma surrounding mental health, and talking from personal experience, also what happens when that focus falls short. This community advocacy is vital so anyone, regardless if you work in this industry or not, can learn to look after their own well-being, as well as find important information to look after their families and their coworkers as well. In the near future, we'll be adding even more resources, including those that are state-specific, and more resources for specific communities such as BIPOC individuals as well. If you do want to reach out to us, our website lists different emails for you to reach out to us, restaurantafterhours.org, or you can private message us on Facebook and Instagram. As long as anybody has access to a computer, you can reach out to us from anywhere in the world.
Perfect. Thank you so much. And we will pass to Genevieve with USBG.
Yeah, sounds good. Let me get my screen shared here. So hi, everyone. I'm the Senior Program Manager at the USBG National Charity Foundation, which is the 501c3 sister to the United States Bartenders Guild. Today, I'm going to talk a little bit about our grant programs that are available in this coming year. We do have education, travel, community service programs as well, but we are going to focus on the resources available for emergency assistance today. The USBG National Charity Foundation was sparked into being when a USBG member dared to ask the question, how do I get out of this industry alive with my health, a little money, and my sanity intact? So the board of directors was a little bit shaken by that very candid question. And in 2014, we founded the USBG National Charity Foundation, whose mission is to advance the lifelong stability and well-being of service industry professionals through education and charitable activities. So it's a very broad mission on our part. We serve those in the hospitality industry who are involved in the serving, production, manufacturing, or distribution of alcoholic beverages. Our programs are open to all residents of the United States and its territories, and membership in the USBG is not a requirement to participate in our programming. The very first grant program that we came up with was the Bartender Emergency Assistance Program, which was sort of put together and sort of the next iteration of the Bartender Relief Fund that was founded in San Francisco in 2012. The BEEP grants seek to provide immediate financial assistance to those in the bar industry who encounter temporary emergent financial hardship due to unforeseen or catastrophic life events. So these can be medical diagnoses, natural disasters, things like that. That center picture is from a bartender in Santa Rosa who lost his house in a fire in those big firestorms a couple of years ago. That's one of our board members, Trish, who had to have shoulder surgery. And this was flooding from a hurricane down in Texas. So we were able to assist all of those grantees with financial assistance. Most of our BEEP grants sort of average between $1,000 and $2,000. So really just depends on the situation. The second of our grant funds is the Helen David Relief Fund, which was founded by Tony Abou-Ganim, a sort of a bar legend currently in Las Vegas, in memory of his cousin, Helen David. This fund assists those in the bar industry who are undergoing cancer treatment. It is a cancer-specific fund, helping everyone. So it started as a breast cancer fund, but now it serves everyone. And y'all can learn more about, these are all recipients of the grants. So we are able to help them when their recovery. For this fund, our grants go up to $10,000. So we're able to actually make a really big impact in somebody's recovery. Couple of our stats over the past, since 2014, we have granted out over $10 million during COVID. We granted out $9.4 million to 33,000 people. Through our community service programs, we volunteered over 20,000 hours. We have a team happiness bike ride every year that helps with the HDRF fundraising. They've ridden over 25,000 miles, and we award between 200 and 500 grants every year. Our data has shown that our philanthropic grants are used for shelter, food security, and medical emergencies the majority of the time. If y'all would like to connect, we are on Facebook, Twitter /X, and Instagram. You can also find us at usbgfoundation.org. And a really interesting thing, if y'all are interested in this, is every Thursday we have an IG Live with different guests on the USBG Foundation's Instagram. We cover everything from mental health to financial security. We talk about upcoming fundraising for our organization, and also different programs that are upcoming as well. So that's on Thursdays at noon Pacific. If y'all want to catch us, that's a great way to do it. So that's about it. Thanks.
Thank you, Genevieve. And we are going to jump back to Alex with Healthy Poor, who's going to do a brief introduction. I'm sorry, Alex with Focus on Health, who's going to do a brief introduction for Healthy Poor, not present today. While we are doing that, I would like to encourage all the speakers. We have a full room now and we didn't before. So please drop your contact information in the chat now that folks can see it. Thank you.
Hey everyone, yeah, so I am Alex Jump again, if you were here earlier when I spoke, and I'm just going to briefly introduce Healthy Poor. Laura Green is the founder of Healthy Poor. She is a licensed professional counselor and is also currently pursuing her second master's in organizational psychology currently. And she founded Healthy Poor, which is a low profit liability company. So it's an L3C, which is very difficult to say for some reason. It's like a weird way to say those words together. Anyway, and they offer a variety of services, from training programs such as mental health at work, leadership, organizational psychology and theory, and well-being in business. They also offer coaching. So that is things like management and leadership coaching, emerging leader coaching, career coaching, which I've personally participated with her, and is really, really valuable and amazing. They do HR and well-being coaching, kind of any coaching you can imagine within the professional setting. And then they also offer consulting. And so her consulting services are really being driven from her history in organizational psychology and her licensed professional counseling career. So she does a lot of bar and restaurant consulting around improving a restaurant's operations and organizational structure so that people are creating very safe, welcoming, hospitable places where their employees can not only exist well, but thrive. She has since expanded her services beyond just the food and beverage industry. So their services are available for a variety of industries, such as the performing and visual arts, STEM, healthcare, retail, academia, and professional schools. Let's see, I'm sorry, I don't work for her, but I love her. So I'm trying to make sure that I hit everything that is incredibly important for her. I'm just going to quickly read from her bio that she utilizes her knowledge and skills as a mental health practitioner to facilitate training, growth, and healing in the workplace, hoping to create safer and healthier environments than what she's personally witnessed and experienced, as she has a background both working in bars and working for distribution. And I'll leave it there.
Thank you. That was a lot of talking. Everyone did great. Good job sticking to your 5 minutes. Everyone was awesome. Great elevator pitches. So as we finish inputting the rest of the contacts in, I'm just going to leave a 30 seconds of space to the attendees in the room if you want to unmute yourselves and ask a specific question.
I have a question. So my name is Kaylee Smith. I run a group called Safe Bars RVA here in Richmond, Virginia. We're looking to expand our services. So I've been in restaurants for 21 years. I also am currently a student in a Master of Social Work program. We're looking to expand our services to bring social workers into restaurants along with like go out in teams of 2, like a social worker and a bartender, and just connect people with resources and give them kind of an open ear to talk to. So I'm curious, I hope this isn't too off topic, but I'm curious for any advice that anyone has on kind of formulating a plan. Like, you know, I'm starting from a place of like, there are so many needs in our industry and there are so many people that don't have access to resources or don't know about the resources that are available. And I want to connect them. That's my baseline. So I guess I'm looking for advice on how to move from having like a baseline idea to having a functional organization.
Haley,
I
I
hope
think
that's not too big of a question.
it's a huge question and I love it. I'm not going to take a lot of time here, but I just would please write down my email address and let's connect and we can have a longer at-length conversation about what you're trying to accomplish and how we might, a lot of us probably already have things in place that you might be able to replicate or utilize, but that's, yeah, let's connect. And then everyone else with their genius on here can share their thoughts.
Same here.
I will say for us, like that's actually how we started in Brooklyn as well, is that we took it just a step at a time. We started with just one restaurant. I went in there, met with the management team, told them who I am, told them what I wanted to accomplish. The problem that I ran into immediately was that a lot of people expected me to work for them. They were like, oh, you know, you see that we're short staffed, like, you know, why don't you come in and like, you know, help us out on the line and stuff like that. And so it's like, no, that's actually not why I'm here. So you may run into some of those walls as well, but, you know, just take it one restaurant at a time, you know, explain your mission, why it's important to you. And sometimes those restaurants will invite you in during their family meal period, in which case you'll have like 5 to 10 minutes to actually do a presentation. Or you can, you know, just be invited back at like a certain time and just be like, hey, we're ready with this presentation. We'd love to talk to your staff and, you know, just see how it goes. But it's like, it's not really like, I can't really give you a clear answer just because like every restaurant is different. You know, every restaurant is run by like, you know, different managers that like, you know, some of them will have the stigma of just like, no, I don't want this in here. Whereas like other restaurants will be more welcoming to it. So, you know, just do it one step at a time and, you know, just try your best.
Thank you.
You're welcome.
I have a question then. I would like to ask Tom, I'm not sure why I don't know this because I have hung out with your folks and I am a big fan as a Colorado Springs local, but how do you go to the big table?
How did I go to the big table?
How does a person, you
Oh,
said
you
that
can
the
go
big
to,
table's being hosted,
as a referral?
or you said that you host big table events because
Oh, it's
there's
by invitation only. So as we do get involved more and more in the industry here, we get more and more contacts. So some of it's a mix of development people, like at our first one, we had the mayor, our new mayor was at the industry dinner at Flying Horse. We've had John Claymire, who's a president and CEO of the chamber. But our goal is to get most of the people at the table are people that are actually normally serving other people. So it's all through network word of mouth at this point.
I like it.
But yeah, it's really, really cool.
Thank you.
Thank
I'll
you
let
for the
someone else
question.
ask a question.
Any of our other attendees have something they want to ask the group or someone in particular?
I don't have any specific questions right now. I'm about to just go and scour all of your websites for all of these amazing resources. So I just want to thank everyone for sharing. As I mentioned at the beginning, I'm in British Columbia. So looking at the Canadian options as well, but really getting some inspiration from things that are available there and all the things that we can do. I've really found a lot of support in this community for what I'm doing. I'm trying to help businesses have healthier workplace cultures, and yeah, all of this work is so commendable. So I just want to thank everyone for doing this today and for everything that you do.
Thank
One
you.
of the places
I
we're
also
being
wanted
pulled
to-
into is actually Halifax in Canada. It's interesting.
Great. That's other side of the country from me, but that's a perfect place to start. And yeah, I would love to see more on the West Coast as well.
And I just wanted to jump in and mention that Not 9 to 5 is in Canada, and they have education and resources as well. And it looks like Shell has her hand up.
Hi, everybody. I also don't have a question. I just wanted to say that you're all absolutely bloody brilliant. And I just love you all dearly. And I can't wait to bring more of what you're doing and what you're building over to the UK. I was just sat here thinking, like, we couldn't get this many people in a room to discuss how important it is to support our hospitality industry. I mean, I know that England's like this big compared to you guys, but still. And it's just super inspiring. And I'm just, yeah, and I've got some of you guys have been on the podcast. Some of you are coming on the podcast. Mickey, I've emailed you. You know, I've been chasing you. But yeah, I just want to just say, just like my heart is full and I think you're incredible. And yeah, just keep doing what you're doing, guys. It's bloody inspiring.
Thank you, Shell. I also just put on the chat that there's the Burnt Chef is outside of or is in the UK for folks that are looking for UK resources. I also want to remind everyone that we are recording this and we're going to share it with everyone who is on the call today, and they'll be on websites and social media so that if you want to share this with folks, you're welcome. Please do so, because it's really hard, I think, to look at all of the resources that are out there. I know we have robust resource pages. Sometimes it's just easier to watch a quick video and skip around and see, you know, who these people are, who they can help, and how to get that help. And then Julia has her hand up.
Julia, you're on mute.
That helps. I was like, can you hear me? Because my headphones were acting up. Anyway, I'm Julia. Yeah, I've been in the industry now for 20 years this year, and I am in a master's program for clinical mental health counseling. I'll be graduating in a couple semesters. I guess my question is similar to what was asked, just how to get involved when there is this kind of like overwhelming wealth of resources. I know a lot of you mentioned, or some of you mentioned, that you have therapists who work specifically with your organization, giving counseling to industry workers, and it just seems like such an overwhelming array. I'm at a loss of where to start. So if anybody has any has any advice, because I'm not working from my own organization. I'm in Asheville right now and probably will be moving back to Chicago in the next year, if that's helpful.
Julia, are you seeking just information about folks that are offering services like that? Or are you seeking opportunities with people who are doing things like that?
Opportunities, yeah. So within the next year, it would be like internship, or just volunteer. And then going forward, how to work with these organizations. I want to make this my career.
Awesome.
Yeah.
Send me an email.
Okay.
All of us have great relationships with a lot of people, and I would love to introduce you. So
yeah.
Same here, Julia.
Julia, I would say to you first, for me, it's finding what you're passionate about. Where do you want to help? It's easy to say I want to help, but focus on the issue that touches your heart, because that's where you'll find the drive and the motivation to really get involved.
Yeah, absolutely. That's great advice. I'll be doing an internship in the spring at a recovery center. So I think focusing in on that area is definitely something I'm interested in.
And Julia,
Great. Well,
depending on what university you're at, if they have a training clinic, we are in the process of speaking with quite a few universities in your state. So there could be an opportunity for an externship there as well. Just feel free to email me on the side, and I'm happy to chat through that. We also have a program in Illinois. So if I can be of help,
Great.
happy to do it.
Thank you. Yeah, thank you all so much for doing this. Appreciate it.
I wanted to add that CHOW is always looking for volunteer hosts and expos as well, which kind of gives you the opportunity to like dip your toe in to see if you if that's kind of your vibe. We are mental health recovery. I know that you weren't here at the beginning of the call, so we do mental health, substance misuse recovery, and overall wellness. And so these are 1 hour long support groups, essentially peer-to-peer support groups. And there's 2 different roles for the people in the room. So it might be a cool opportunity for you to see if that's something that you enjoy, and it's working, one-on-one with hospitality folks in a group setting. So if you're ever interested, my email's in the chat as well. And we can take you through. It's a very low stakes opportunity kind of engagement.
Yeah, that sounds great. Thank you.
We have about 8 minutes left. If anybody else has a question or comment.
I will say one thing, because there's somebody out here waiting for me. Anybody knows anybody in the industry in any city, I would love to talk to them, because we want to start Ben's Friends chapters in as many cities as we can. We need somebody with at least 2 years of sobriety, preferably 2 people, but the first person usually helps us find somebody. We'd like to have, that 2-year sobriety is really important. We don't care how they got sober. We'd like to have somebody with a little AA experience, because I will tell you point blank, I hand walk people here into Charleston into AA too, letting them know Ben's Friends is a community, but I believe in the foundation that AA can give somebody. That's my personal preference, their belief. But please reach out to me at bensfriendshope@gmail. If you know anybody, send them our way. And thank you for inviting me. And I'm sorry to be rude. I'm in awe of all of you. I'm a simple guy. I keep it very simple. You guys are doing fucking fantastic work. Keep it up. God bless all. Take care.
Bye, Mickey.
Bye, Erin. Nice seeing you.
Take care. Alrighty, I think that might be it. So thank you everyone who's attended today. Again, we will get this recording out as soon as we can. It'll be on our YouTube page. Everyone else on the call will also get the a copy of the video. Unless you're an attendee, if you want a copy of the video, please send an email to jasmine@community@chowco.org and she can send you this so that you can share far and wide with everyone you know in the industry. So thank you all.
Thank you, everyone.
you.
Thank you.
Thank you very much.
Have a great one, guys.
Bye.
Thank you all.